And since the coup's taken place, obviously a much more difficult environment, could you explain a little bit about how THET has been working with healthcare workers since the coup?
The coup is devastating. We've seen at least 20 Burmese health workers killed. At least 280 have been arrested, subject to violence. We've seen the systematic persecution of health workers during this time. And it's absolute tragedy, and it's one of the worst aspects of what we call the white revolution, or the opposition to the coup. And what we had in February the 1st was a moment of choice about whether to lean in and continue to help the Burmese and exchange information between us, or whether to say this is too complex and we need to walk away. So since the coup, we've been absolutely astonished that the appetite for online training has increased, and we're working with thousands and hundreds of nurses and doctors exchanging information.
With all the other crises, myriad crises going on around the world, do you fear there's a danger that Myanmar, with its particular hazards towards healthcare workers and indeed other aid workers, gets forgotten by the international community?
I do think there's that danger. I think in some ways the UK is doing brilliantly. The strong statements today on the anniversary of the coup, the statement yesterday, which was around increasing sanctions on individuals associated with the military regime. In some ways, the UK is leading the way, and it's a very strong voice which needs to be praised. There's no question, though, that we feel the absence of UK aid at 0.7. So that availability of funding, that ability to do more good with more funding is keenly felt. And at a time like this, when the Myanmar people are really looking to the UK for sustained support, we need that commitment to UK aid, not just to support THET's activities, but just think about life in the ethnic communities on the borders of the country, the internal displacement of people, the humanitarian crisis is huge. And there is, as you say, something worrying about the political fashions. Just seen that huge announcement of funding to Afghanistan. All of these are deserving causes, but we need that uplift of UK aid fundamentally in order for Britain to play its role and make its contribution.